Welcome to Leadership Wilmington Session 4, which was all about health and human services. Just a quick disclaimer, this day was pretty heavy. We get up close and personal with some very, very difficult issues. The services and organizations that we talk to today are dedicated to helping people when they are really at their lowest. Our objective today is to experience the issues and challenges faced by those individuals and families who require public assistance. Our day started with the tour of the Good Shepherd, which is a homeless shelter here in Wilmington. We were asked to bring some non-perishable items that we donated. We received a guided tour of the facility, and one of the members that worked there split us into groups, and we toured their entire facility room by room. We talked about all the various services they have there for individuals in need. We saw the dorm rooms where they stayed, and these rooms are constantly full, and this was a sobering reminder of the need to house the homeless population here in Wilmington. We were served food there by some of the residents, and they usually see over 300 people during lunchtime. We heard from Katrina Knight, who is the executive director there at the Good Shepherd. She talked about the importance of the facility and how they are growing and the impact they have on the homeless population in Wilmington. There are all kinds of volunteer opportunities, and they need help always. Katrina really drove home the point that the Good Shepherd is oftentimes the very last resort for somebody. Most of the people that show up here don't have a family to go to. They don't have a shelter. They don't have money. They don't have anything. It really made me realize how blessed I am that I have support in my family and in my life. After that, we traveled to the Roastery by Vigilant Hope Roasting. Their mission is to inspire dignity and good purpose for those that are battling poverty. And also, they make great coffee. We first heard from Lori Whalen, who is the president of Novant Health in the Scotts Hill campus and the COO of Novant Health, New Hanover Regional Medical Center. Then we heard from one of our own classmates, John Campbell, who is the New Hanover County Health and Human Services Director. He told us about all the amazing programs that are offered through his department. For example, the Safe Kids program. The health department also did over 4,000 restaurant visits. They designed septic and wastewater systems. He talked about how they put a nurse in every single school in New Hanover County, and those nurses took over 62,000 visits last year. I was blown away by the number of programs that we have to support people in need in this community. And John is a passionate and driven leader, and I can tell he really makes a difference here in our community. It's moments like this that I realize just how high of a caliber the other classmates in this program are. It's absolutely insane. We then heard from Yasmin Tompkinson, who's the executive director for the Cape Fear Literary Council. We discussed literacy rates here in New Hanover County and what the council does to elevate that. We learned about the importance of literacy in our community. I learned that prison capacity is planned based on third grade literacy and test scores. If that doesn't tell you how important literacy is in our community, I don't know what does. Then we heard from speaker Dawn Farrer, who is the executive director with A Safe Place. A Safe Place is a nonprofit whose mission is to work with law enforcement and support victims of sex trafficking. We talked about the rise of sex trafficking and the devastating impacts it can have, and the measures and strategies in place to stop it. We then heard from Lakeisha McDay. She is Executive Vice President of Programs and Operations in New Hanover County. We talked about how the endowment was funded and the impact of philanthropy here in our community. Then we did an extremely impactful exercise. It was called the Poverty Simulation. We were divided up into groups, and each small group was given a scenario, and that scenario was based on an actual situation of someone that came through Vigilant Hope. Our objective was to live for a few hours in their shoes and experience the type of issues that they would experience having the resource that they have available. Our group was assigned a story of a young woman in her early 20s. She is working multiple jobs, and she also has no transportation herself. Our job was to simulate living in this situation, and we had $15 to stretch for a week, and we had to make sure to feed her. So the closest grocery store was about a mile away downtown, so we began the walk. As we were on this walk, our guides challenged us to really reflect on what it would be like to be a young single woman walking a mile just to get her groceries. Now, luckily, the weather was good, but if it had been raining or cold, this is a much different experience. So we finally made our way. We found a Dollar General X right downtown. I was just trying to figure out how we get the maximum amount of calories for the lowest amount of dollar. We only had $15 here. This was very difficult. The group finally came to a consensus of how we were going to spend this $15 to sustain this young woman for a week. We had rice, we had some bananas, some eggs. We tried to get this as basic as possible. And then our tour guides told us that, we actually would just be starting our cycle.
Or we started our period. We need to buy tampons.
Yeah.
Okay, bananas. Everyone probably going back.
Are we allowed to go?
Our group was 4 or 5 men in their 30s and 40s, none of which have had to purchase feminine products on a budget. But I thought this was a very, very fitting real-world example of what would happen and how something like this would disproportionately affect women in this scenario. It was kind of funny to see the other guys squirm a little bit and have no idea what they were talking about. But we figured it out and we made it happen. But it really opened my eyes to imagine how difficult that must be if you were that young woman and you had no car to get to your jobs, you had no money, you're barely getting by, and then you have to take care of your personal needs on top of that. That's very difficult. It was very eye-opening. So on the way back, we discussed how blessed that we are, and we discussed how important these services are in places like Vigilant Hope to help those in need. One of the members of our group actually has a daughter who is the same age as this scenario that we were living through. And he talked about how devastating that would be to know that his daughter was in this position and needed this kind of support, especially if she didn't have someone. I'm so thankful for organizations like Vigilant Hope, and I'm just thankful that we have programs and public assistance out there for those in need. Most of you watching this video will probably not be in this scenario, probably won't need this type of assistance, but I can guarantee you that you know someone who has or is utilizing services like these. So it was eye-opening and inspiring to know that our community has that public assistance to offer, and now I know better where to direct someone when they do need that. I'm so thankful for this session and everything that I learned about the public assistance available here in Wilmington. And that's it for session 4 dedicated to health and human services. I hope you enjoyed this video. If you have a question or comment, please hit the subscribe and the bell so you will be notified when future videos drop. I'm working on session 5 right now. Thank you for following along on this video. I really hope that you enjoyed this series, and I hope that I will see you for the next session, session 5.